Hi, Chris Geller here again, back with Nickel Training Consulting Systems, and now we're going to the knee. So we previously talked about the shoulder, some shoulder musculature and joints and how the body works and research. So when we look at the knee, I think the key thing to look at, remember there's a lot there. I'm going to try to simplify it as best I can, easy to understand. You have your patella, which is your knee bone or sesamoid, quad tendon, which is above, patellar tendon below. Your big bone is your femur, little bone again the tibia, and this guy again is the fibula. When you look at supportive structure, when I say supportive that help out, think about providing support laterally and medially. So again, medially you have the MCL, stands for medial collateral ligament. You've got your LCL, your lateral collateral ligament, and then inside you have your ACL and your PCL. Now your ACL prevents anterior, which means forward translation of the tibia on the femur. The PCL prevents posterior translation of the tibia on the femur. Okay? You also have a bursa on the top, that's the suprapatellar bursa. Down below you have what's called the peripatellar bursa. On the sides you can see in your manual, you have things called retinaculum, and that's basically connective tissue that provides support from a cobweb, not quite like fascia. But inside the knee joint, if you look inside the knee joint here, you can see there's meniscus. The meniscus are basically cartilaginous structures to absorb stress. So every time you come down, walking, jumping, running, the meniscus absorbs stress. And on the inside, that stands for the medial meniscus, and on the outside is the lateral. One thing you'll notice from a visual point of view is the size. The medial is smaller. It's a C, like a C-shaped. The lateral is larger. It's like an O. It's bigger. So, conversely, what the research shows, the MCL is thinner than the LCL. The medial meniscus is weaker along the outer part, that lateral zone, compared to the lateral meniscus. So, where people have more injuries is medial ligaments, medial collateral ligament and medial meniscus. You'll see in the manual there's a lot of different types of tears. There's about 8 tears that are in there. I'm not going to go through those today. But if you have an understanding of basically where these things are, you can see a little about structure and function. The other thing too I want to talk about briefly is just biomechanics. So this is straight extension. We go from flexion, which means the tibia is here. I'm sorry, the femur is here. This is the tibia. To extension, you can see that the tibia glides up. Patella slides up on the femur, and the ligaments here become taut. The other thing too to see is that the meniscus go up as well. Now if we go from extension to flexion, right, patella slides down, tibia goes down, meniscus go backwards or slide posteriorly, and the collateral ligaments become flexed. All right? So when we think about movement, we need to think about how we move from the outside in and the inside out. Hopefully that it can help you. On the back side, remember, is the hamstrings. Medial hamstrings are attaching from the ischial tuberosity along the medial joint line or mid-four condyle. And you've got bicep femoris, which attaches along the lateral femoral condyle. Okay? I hope that gave you a little more insight into the knee. In the next section, we're going to talk about mobility, stability, control mobility, and skill. Kind of talking about why we need mobility for anything else.